Hello, thank you for joining us today for our Risk Factors for Stroke presentation. My name is Emma Miller, and I'm the Marketing Communications Specialist at McLaren Bay Region. We are excited to have you join us for today's program. During today's broadcast, if you have questions, please feel free to comment, and they will be addressed at the end of the presentation. I am honored to introduce Dr. Dan Lee, Interventional Cardiologist with McLaren Bay Heart and Vascular at McLaren Bay Region.
Thank you, Emma. Well, let's get started. Welcome, everybody. Good evening. We're going to talk about stroke prevention, and specifically, I'm going to talk about the management of high cholesterol and the reduction of strokes. Just a little background information. Every 40 seconds, someone in the United States is having strokes. That equates to about almost 800,000 to 1 million new strokes yearly. In the U.S., it's the leading cause of disability and the fifth leading cause of death in the United States. It is the second leading cause of death worldwide. Well, let's start with the definition of stroke. Let's get an idea of what we're talking about. A stroke is an insult to the brain, either due to the blockage or a rupture of a blood vessel that leads to the brain. 80% of the strokes are what we call ischemic, which means the brain doesn't get enough oxygen. There's a blockage to the blood vessel that goes to the brain. It could be from atrial fibrillation, where you develop a clot and it blocks up an artery and you have no flow to the head, again, no oxygen. It can be due to a very tight blockage in the neck artery. That again leads to decrease of blood flow and oxygen to the brain. And don't forget hypoxemia, or what we call sleep apnea. Some people will stop breathing for 18, 20 seconds, decrease their oxygen, and have a stroke in that form. Again, not enough oxygen to the brain. The other 20% are what we call hemorrhagic, in which the blood vessels in the brain literally just explode, they burst, and that causes a significant insult to the brain tissue. What are the warning signs of a stroke? Here at McLaren, we like the Be Fast acronym. Balance. Is there a sudden loss of balance? Are you unsteady on your feet? E for eyes. Can you only see out of one eye or only see the right side of your visual field? Face. Is only one half of your face numb? Is your face drooping? Arms. Is your left arm not working? Speech. Maybe you're not making sense or having a hard time getting the words out. And T is a terrible headache. If this is the issue, then we want to be fast. Call 911. This is not where you go finish doing your dishes and do whatever and brush your teeth. You call 911 and please seek medical attention immediately, because the more you wait, the more that there's insult to the brain, the more potential of brain damage. Well, what are the consequences of a stroke? Let's look at the disabilities after a stroke. Weakness in one side of the body leading to trouble walking, 75 to 80%. You may have a hard time speaking up to 40% of the time. Need assistance in daily activities up to 85%. Visual loss, 20%. And you can see with all these disabilities after stroke, you'll be depressed 40% of the time. The long-term consequences, 30% die within 6 months of your stroke. 30% require daily assistance. 20% help walking, 16% end up in a nursing home, and up to 70% of Americans are work impaired. And you can see by these long-term consequences why stroke is the leading cause of disability in America. Let's put things in perspective. Stroke affects women more than men, but twice as many women die from a stroke than breast cancer. Well, everybody knows Breast Cancer Awareness Month, but not too many of us know Stroke Prevention Month. Meanwhile, stroke is a bigger killer than breast cancer. So that is part of our objective today. We want to be more proactive and not reactive. So why am I here? Why am I not golfing? This is my weekend in Petoskey. I did miss that putt there, but we are here because if you follow these 10 risk factors, and you may be able to reduce your stroke by 80%. So that's why our team here at McLaren Bay Region is here presenting to you stroke prevention. All right, let's talk about the 10 top ways to prevent a stroke. Number 10, your diabetes. You got to control your diabetes, lose weight, take your medications, listen to your doctor. Your target hemoglobin A1C, and if you're a diabetic, you understand that term, is an A1C of 7 or less. Stress is terrible to the heart, your health, it leads to strokes. Stress leads to unhealthy behaviors. You're not eating right, you're eating late, you're not sleeping. Stress has been shown to increase your risk of having a stroke. Alcohol use. No, I'm not talking about drinking more alcohol. It's talking about drinking less alcohol. And people who drink more than 2 drinks a day have a 34% higher risk of having a stroke. Our recommendations, not just for stroke prevention, but hypertension management, is no more than 2 drinks for a man and 1 drink for a woman. High blood pressure and high cholesterol are probably the most strong, predictable instigators for heart attacks or strokes. These are your big controllable risk factors, and these are the big 2 that we emphasize. Back in February, I did give a talk on high blood pressure, and you should be able to acquire that talk on Facebook. Smoking doubles the risk of having a stroke. As you can imagine, stroke decreases the oxygen content in your blood. Subsequently, as I mentioned before earlier, you don't get enough oxygen to your brain, you get a stroke. The nicotine and the carbon monoxide that are in the cigarettes are extremely caustic to the blood vessels and cause damage. Number 5, obesity. Obesity leads to what we call the metabolic syndrome. That is characterized by high cholesterol, high triglycerides, and high sugars. We know that the metabolic syndrome, we call it, increases your stroke chances by propagating clots to the brain. Number 4, poor diet. Basically, eat less of what tastes good and eat more of what does not taste good, okay? Increase aware of the unprocessed food, horrible, lots of salt, eat fish, lean protein, and they're talking about hydration lately. That's the latest new kick on stroke prevention, because you can imagine if you're dehydrated, it'll improve your chances of having a clot. The blood gets more viscous. Then again, limit the sugars, processed foods, red meat, and fried foods. Number 3, you should be exercising 30 minutes a day, 5 days a week, okay? Again, this will help everything, blood pressure and stress. I tell my patients particularly that have heart disease, whether they've had a stent or bypass surgery, to get a treadmill, because in the state of Michigan, you can only walk outside about 5 months out of the year. So they need to walk 30 minutes a day, 5 days a week. And if you can imagine this, if you come to see me in the office and you're walking on the treadmill 30 minutes a day, I am not going to do a stress test on you, because if you have a blockage, you will have symptoms on your stress test of chest pain. So a great way to stay healthy and watch how you're doing from a cardiovascular standpoint. Okay, number 2, I will focus on number 2, but it is the second best way to decrease of having a stroke, and that's going to be our focus discussion that I'll expand on later. And number 1 is hypertension. And again, that's why I gave a hypertension back in February. Hypertension will reduce your stroke by 50%, reducing your top number by 10, that's your systolic, or your bottom number by 5, that's your diastolic. That will reduce your stroke by 50%. And remember, don't use a wrist blood pressure cuff. Use a blood pressure cuff that goes on the arm. Be in a sitting position, arm resting on the table, wait 4 or 5 minutes, then take your blood pressure. Ideal is 120/80. 130/80 is acceptable, but we want you down to about 120/80. High cholesterol, that's going to be our focus tonight. Okay, there are a lot of modifiable risk factors. Again, I talked about hypertension back in February, so my focus tonight is on high cholesterol. Before I move to the next slide, there's something you have to understand. 80% of all the strokes and heart attacks are caused by blockages that are 50% or less, okay? That doesn't make much sense, does it, right? How does a 50% blockage cause a heart attack or stroke? It's only 50%. There's good blood flow. It's because these 50% blockages, whether it's to your head or to your heart, these 50% blockages act like a blister that are ready to pop. They're very soft. They're very fragile. So extreme stress, dragging a deer when you're grunting, when you're bearing down, snow shoveling, that will cause that plaque to rupture, that blockage to explode. When this blockage explodes, all that pussy stuff that explodes out of a plaque are called platelets, and that's what causes the occlusion. So in this next picture, this video, I'm gonna show you a plaque rupture. Okay, again, 80% of all our heart attacks are caused by blockages that are 50% or less. There's a 50% blockage, just passed a stress test, just did some running, felt great. A day or two ago, all of a sudden he did heavy shoveling and started having chest pains, and all of a sudden now his plaque is completely ruptured. And again, that volcano, that lava stuff that comes out are called platelets, and that causes a complete blockage to the head or a heart, causing a massive heart attack or a stroke. So when I look at this is, we're getting a little scientific, but this is fun and it's gonna make a lot of sense. In the left side, we have a camera inside the heart artery, and this is what we call an ultrasound, an intravascular ultrasound. That thin white cap there, that's called a soft plaque, okay? So when I put a camera inside the heart artery and I see that soft plaque, I know that thing's gonna rupture. This guy's at high risk. This person has risk factors that need to be modified. Look at the slide now on the right. You can see how that thin little cap is turned into a thick crescent, like the moon. That thick crescent is what we call a very stable plaque, okay? Modified risk factors, but this is the same artery 2 years later on what we call a statin, a cholesterol pill. So you can see what the cholesterol pill does to the plaque in 2 years. It takes the soft, unstable plaque that's prone to rupture and stabilize it, makes it hard like a callus, and very difficult to cause plaque rupture, heart attack, and strokes. That's why our data with statins, otherwise known as high cholesterol pills, are extremely helpful for the prevention of heart attacks and strokes. Here's another way to look at a statin. This is what we call the long-term plaque regression study. On the lower left-hand corner, again, this is a camera inside the heart artery. This is when I do what I call intravascular ultrasound, which is, again, an ultrasound by placing a wire inside the heart artery. That yellow stuff is a blockage on, say, day 1. After 2 years of a statin, look what happened to that blockage 2 years later, okay? Yes, what you're seeing is actual plaque regression. So not only does the statin or the cholesterol pill prevent plaque rupture, but we also have long-term data showing what we call plaque regression, preventing the blockage from worsening. And if not worsen, maybe even regress. So the treatment for high cholesterol is very simple. We divide it into 4 categories that I'm going to touch on really briefly. One is if you have coronary or peripheral arterial disease. The second category is diabetics. The third category is familial hyperlipidemia. And finally, the fourth category is what we call primary prevention, and I'll expand on each one of these. If you've had coronary disease or peripheral artery disease, which means if you've had bypass surgery, a stent, if my vascular team, Dr. Muwad or Dr. Hui, has cleaned out your neck artery or done a AAA surgery or bypass your leg, that's called coronary disease or peripheral vascular disease. Look at the column in the lower left-hand corner. You should automatically be on a high-dose statin, either Crestor 20 to 40 milligrams or atorvastatin 40 to 80. So if you come and have a heart attack, you're 65 years old, and even if your cholesterol level is, say, total 100, that's a great number, it doesn't matter. You saw those plaque studies. We are treating the plaque. We don't treat the number with the statins. We're treating the physiology. And so that's why we don't even look at the numbers anymore if you have either coronary or peripheral artery disease. So again, you should be on a high-dose statin. Diabetics, very simple. Any diabetic over the age of 40 should be on at least a moderate dose statin, and the majorities are on high-dose statins. So please keep in mind, if you're a diabetic, get on a statin and stay on a statin. I want to take a couple of minutes with, not a couple of minutes, but a little time with familial hypolipidemia. This is very, very interesting and pretty common. It's a genetic disorder in chromosome 19. Okay, so you're born with this. Someone in your family gave this to you. You have the inability to clear the LDL, which is the lousy cholesterol. Okay, so what happens is that these lousy cholesterols, because you cannot clear it, are floating all over throughout your blood system. Okay, your arteries. You have early neck blockages and early strokes and heart attacks. So if you look at the little pedigree on the right, what happens, and I tell my medical students, when you do a history, when you take a history, find out specifics of the family. Yes, my brother had a heart attack at 40. My sister had a heart attack at 40. My dad had a heart attack at 40. My dad's mother had a heart attack at 40. So clearly you see there's some kind of genetic predisposition. Then what we do is we draw the cholesterol level, and sure enough, if the LDL is greater than 190, that makes the diagnosis for this syndrome called familial hypolipidemia. If this is untreated, as you can expect, you can have early blockages, and in the more severe form, you see heart attacks in 20 years old, 25 years old, very, very common. The key point I also want to make off this slide is that if you're a 40 or 50-year-old, or let's say even a 20 or 30-year-old that has been diagnosed with familial hypolipidemia, you need to have your kids checked. They are starting statins, these cholesterol pills, even as young as 13 years old. Why? We'll refer back to my plaque regression study. Your 13-year-old is starting to develop plaque progression if they have familial hypolipidemia. Unfortunately, they have to start a statin to treat that LDL. Unfortunately, despite a high-dose statin, this genetic disorder is so powerful that we're unable to clear the LDL efficiently. So we have a injectable once every 2 weeks. It's an injectable called a PCSK9 inhibitor that helps drive the LDL down to our goals. So you prevent future events. In fact, updated here, the data has been knocked out, but September 2021, I believe it is, I'm keeping you guys up to date. Repatha, which is a PCSK9 inhibitor, that injectable form of LDL reducer, has been approved by the FDA for 10-year-olds or less even. So if you have this genetic disorder, make sure your kids are checked because they can be helped. We don't want them to have early progression of disease. Finally, we're going to talk about primary prevention. Primary prevention is a little confusing, and basically it's, okay, I've never had a heart attack, never had peripheral vascular disease, I'm not diabetic, I don't have familial hypolipidemia, I'm the regular 63-year-old guy walking around without any real medical conditions. Should I be on a statin? Okay. Well, there's two things that we look at. Number one, there's a little calculator or a scoring system that we use called the 10-year risk score. You punch in your age, certain risk factors, and it calculates at 10 years what your risks are. If your risk is 7.5 or higher at 10 years, you should be started on a statin. Okay. Now, where does this come from? Well, let's look at the Jupiter study. This study is extremely important, sort of confusing, but I'm going to make it very simple. This was a study looking at, again, of primary prevention, treating a first-time heart attack. You've never had a heart attack, never had a stroke, you're clean. And what they did is they randomized them into 20 milligrams of a statin. In this study, it was Crestor versus placebo. And you didn't know what you were getting, either a statin or a placebo. And to put things in perspective, I'm sure someone out here, I'm missing a slide. I'm sure someone out here is 63 years old. The average age was 63. The average LDL when they started the study was 109. And at the end of 2 years, about 2.5 years, the study was stopped by the steering committee because they felt it was unethical to progress with the study because the clinical endpoints were so significant. So what that means is that the average age was 63, average LDL is 109, and at the end of the study, the LDL was 54. The steering committee stopped the study because the people on the Crestor had a 54% reduction in heart attacks, 40% reduction in stroke, and a 20% at least reduction in death. Okay? So talk to your docs. Primary prevention is very helpful. Statins are helpful for not just history of coronary disease, peripheral vascular disease, familial hyperlipidemia, and diabetics, but if you have a certain score, you should be on a statin. In conclusion, I think this talk was about 30 minutes, and statistically, we have just had 40 strokes in the US. Don't be a statistic. Follow my top 10 list to reduce your stroke by 80%. If you're having signs and symptoms, be fast and call 911. And thank you. That's the end of my talk.
So much great information, Dr. Lee. We have a number of questions that have been submitted, and our first one is from Brandon, and he says, can you tell me about the role of aspirin in having a stroke?
Aspirin, we used to throw aspirin out like candy. Take an aspirin and prevent a heart attack and a stroke. In 2018, they came out with a study saying, you know what, guys? Maybe, and this is for what we call primary prevention. I'm sorry, let me emphasize. If you've never had a heart attack, you've never had a stroke, we do not prescribe aspirin anymore, okay? It helps a little bit, but it increases also the risk of having what we call a hemorrhagic stroke, bleeding into your brain, like I showed you in the slide, okay? So again, we used to throw aspirin out like candy, but we do not anymore for primary prevention, for preventing a heart attack or stroke, okay? So in fact, the hinge point is 70 years old. For some reason, well, age obviously has to do it. After the age of 70, you're increasing your chance of having a hemorrhagic stroke with an aspirin. So basically the balance doesn't work. The risk outweigh the benefits of having an aspirin to prevent a heart attack or stroke. That's a very good question, Brandon. Thank you.
That is very good to know. Thank you, Dr. Lee. Our next question is from Frank, and he says, stroke runs in my family. Are there any tests that can be done to see if I am at risk, even though I lead a fairly healthy lifestyle?
Yeah, Frank, that again, another good question. Number one, it's a very loaded question. You have to know what kind of strokes that your family had. There are many, many causes of strokes. I did not even touch on all the different causes of strokes. So you'd have to find out what kind of strokes your family members have had. Yes, healthy lifestyle is the best thing you can do, but check your blood pressure, check your cholesterol level, lead a healthy lifestyle. That's pretty much all you can do to help prevent a stroke.
Frank also asks, has COVID had any effects on stroke?
COVID has affected strokes in many ways. Number one, unfortunately, COVID causes the blood to get thick. So we see not only blood clots, we've seen strokes, we've seen heart attacks. And one of my staff members, we don't call it the freshman 15, but the COVID 15, maybe even the COVID 30 pounds. With COVID, you get bored, you watch Netflix, you eat too much, you gain weight, then you get your whole cascade of high blood pressure, high cholesterol, metabolic syndrome. It's just COVID has been horrible for us in stroke prevention and heart prevention. And not only that, think about what happens. You don't want to come to the hospital because you don't want to catch COVID. Meanwhile, time is heart muscle, time is stroke muscle. You're not seeking medical care attention like you should be. And so it's been a great impact. We're seeing heart attacks and strokes way too late in the game.
Thank you, Dr. Lee. We have time for one more question. And the question is, what are the risks of a younger person having a stroke if their diet has been poor as of recent?
It's this particular comment is hard to prove because what I'm telling you, the facts I'm telling you is based on data and facts. I'm not aware of any studies taking a young person and looking at poor diet at a young age, but obviously we know childhood obesity, if we're looking at an obese individual, has a very high increase of incidence of heart attacks and strokes. So, you know what? Not only do you have to modify your risk factors early, but that's a way of life, the way you live. You've got to modify your life factors early and make that consistent throughout your life.
Thank you. And those are all the questions we have time for today. If you have any other questions, you can still ask, and we will pass these questions along to Dr. Lee. We can't thank you enough for sharing your time and knowledge with us. And I would like to take this time to share some information about our upcoming heart health and stroke screening that is scheduled for Friday, October 29th at McLaren Bay Region's East Medical Mall from 8 a.m. to 12 p.m. It'll include a full lipid profile, which means total cholesterol, HDL, LDL, blood pressure, and so much more. Healthcare professionals will review your results and help develop a risk reduction plan. The cost is $10 per person. And to make your appointment, just call toll-free 1-877-411-2762. And for more information, you can always log on to mclaren.org/Bay Region and check out all of our upcoming events. Thank you again for joining.